Welcome back to our Unclenched podcast, episode number 7. Today, we're going to talk about Band-Aids that are often used by patients and practitioners to calm down TMD, and they're typically short-term. At the end of the podcast, we will answer a couple of questions from the listeners. But before we get started, we got to get caught up with Miss Priya. How you doing, Priya?
I'm good. You know me, I'm always busy with the kids, busy with the practice. We have some trips planned this year and some family events. And so, yeah, just keeping busy. I'm doing really well. How are you? What's new with you?
Well, I'm doing good. So this past month, we did something really, really neat and fun. And probably about a year ago, I had a guy out to my house to cook pasta, Ryan Peters from Pittsburgh Pasta. So, and he taught my team and everybody how to cook and make this pasta. So then I got this brilliant idea to have him go to the hometown that I grew up in, which is Weirton, West Virginia, and cook for the city. So all my team, our family members, we volunteered and we cooked up a bunch of pasta and fed people. Weirton is a real, it's an old mill town. So a lot of things are closed in stores and socioeconomics, you know, some people do extremely well and then some people not as well. So we wanted to get together at a team with all the girls at the office, like I said, and my sisters and what have you, and feed everybody. So yeah, it was great.
I love that. You have such a big heart and you're such a nurturer. I know you love feeding people. I know you do. I love that.
Thanks.
Oh, I love that.
So thank you. So let's get talking about like a patient. So I had a patient this past week that came in and you know, I do things just a little bit different than you with DTR and stuff like that. But this was just an orthotic patient that I had seen for years upon years. I'm going back to 2010. She came in and she had a lot of missing teeth in the back of her mouth. And so everything collapsed. And
sure.
And I put her in an orthotic back in 2010 and then a partial denture so we can keep that joint down, keep the muscles relaxed and everything like that. And so then all this time she's been wearing orthotics because she needed that posterior support and with a partial denture.
Sure.
But her teeth before that, they were all broken down. They were discolored. They were just really not pretty. And so finally she stepped over and she's like, okay, Alex, now just restore me. I'm sick of getting an orthotic every couple of years. And so we restored her and she looks beautiful and she loves it. And her symptoms were mostly neck pain. And neck pain, she had some headaches, but they weren't debilitating. She could take some Motrin and they would go away. And but the neck pain and then the cosmetics about it, she didn't like prior to her orthotic. Once her orthotic got in there and kind of lifted her up, it was like an instant facelift.
Sure.
But so now she has pretty teeth to match her beautiful soul. So
I love that.
Yeah,
that's
that was
exciting. Oh, that's so exciting. Well,
how about you?
The patient I was going to talk about today is one who came to see me and she had tried Botox one time. The first time it worked really well. And this wasn't with me, it was with another dentist. And the second time she got it though, it didn't work at all. And her pain actually got worse. And so this kind of speaks to what we're going to talk about in today's episode anyways. And so she started treatment with me. Her concern was jaw pain on both sides, kind of all the time. It was constant. It was in the jaw, but also in the cheekbones, dull, aching pressure, just constantly there. She had her jaw had actually locked closed a few times. She had incidents where it would lock and then it would unlock and then it would lock and then unlock. And that scared her. And if your jaw has ever locked, mine has locked once. It's terrifying. You can barely open your mouth. It's super painful. It's not fun. And she was having those episodes. They were becoming a bit more frequent when she came to see me. clicking and popping on both sides, and then a lot of pressure in her right ear. And then
Mhm.
once we started her treatment, she's completely resolved. We haven't used Botox at all. I generally don't use it unless a patient really twists my arm, but I
Uh-huh.
generally don't use it at all. And uh, she's doing so much better. All the symptoms are gone. So no more pain, no more locking. The clicking and popping is still there. Like she always kind of had that late opening click, which I think we've discussed is one of the hardest ones to just get rid of entirely. But she's not locking at all. And the pressure in her ear is gone. And she said that she's sleeping better than she ever has in her whole life. So
Wow.
she is loving life. I mean, if you saw her at the start of treatment, if you saw her now, it's like she's two different people. And she's
I'm
like
sure.
a young mom of two, very fit, healthy, athletic, like coaches her son's teams. And she's just doing so much better. So
Oh.
she really stood out in my mind. She's just, and the first time I saw her, she was so withdrawn, crying, just super anxious, super worried. And this last time I saw her, we like talked the whole time. She told me all about her life, her kids, like
Oh.
so happy, so bubbly, so energetic. And I was like, good, like she's living her best life.
Right.
Isn't that
Because
what
of
we
you.
want?
That's so gratifying for
It's
sure.
amazing. I love it. I
Mhm.
love what we do.
Mhm.
But yeah, let's get on with this episode. So I wanted to start off with some common treatments that our patients have gotten before coming to see us. And there's a laundry list really of these treatments because there's a lot of different things that can kind of help you to feel better for a little while. And we're calling these
Mhm.
band-aids, right, in this episode.
Right.
So there's
Right.
massage, there's
Yep.
acupuncture, there's chiropractic care, there's physical therapy,
Mhm.
there's cold laser therapy,
And
and
I've got 2 big ones,
yeah, yeah,
the Botox that you said and medication. Now that you've heard our list, we gotta start checking them off, and let's go
yes,
through these.
yes, yes, got it. I'll start with massage. So I
Okay.
actually use massage daily in my practice, and so there's a lot that we're trying to achieve with that massage. And so for me, what it does is I actually look for in both the SCM, this big muscle here, and in the masseters, I'm looking for tight knots, tight bands of tissue, trigger points, and I'm
Mhm.
massaging those out with my hands.
Mm.
And I also use it's called the TheraFace Pro. TheraFace
Oh.
Pro, TheraBody. If you're listening, I've been trying to reach out to you so you can give me a discount code for my people and no one's getting back to me. So let me use this moment
Yeah.
to please get back to me. But the TheraFace Pro, it's $400, but what it does is it has this massage motion to it that's a lot more gentle than like a big Theragun. You don't want to put that
Yeah.
on your face. Please don't do that.
No,
But what
no.
it does is it really helps to work out those knots. So I use my hands, I use the TheraFace Pro, and then I use my hands again, and the knot's gone. So I love
Wow.
that thing. It's amazing. And it has a heat
Mhm.
setting, a cool setting. This is like not an ad for them, but I just love it. I use it daily at my practice. But what massage does is it relaxes the muscle tissue. It reduces painful contractions and spasms in the muscle. And this all leads to pain relief. And massaging those trigger points out can also reduce compression on the nerves, which is also
Mhm.
causing the pain. So I
Yeah,
love
I mean,
massage.
right, and when you think about it, when the muscle's tight and contracted, every muscle in your body has a nerve, blood vessels, lymph tissue that go into the supply that muscle. So if a muscle's tight and constricted, you're cutting off the blood flow, and the nerve may be impinged upon, and that can be causing you the pain, and your muscle's not able to go through that the Krebs cycle and all of that and get rid of and flush the toxins, and
Mhm.
the lack of oxygen also causes the pain.
Yeah,
And there are
totally.
different types of massages that you can do too.
Yeah, yeah. And trigger points in some of the most common muscles are really what I'm looking for. And yeah, I do also
Mhm,
do the temporalis. I know I didn't mention that. I do the back of the
mhm.
head, and I spend a decent amount of time massaging my patients in all of these areas, and they love it, and I also love doing it because
Yeah,
I know that it
yeah,
helps them to feel good and have a good rest of the day, a good night's sleep, and it's flushing toxins out of the muscles. It's promoting lymphatic
right.
drainage. There's so much benefit to it, and so I really enjoy doing it. And And, when we say like Band-Aid treatments, that doesn't mean it's a bad thing. Anything that helps
No.
temporarily is still helping. So I just wanted to clarify that.
Right. Right. And I think you need to hire a massage therapist so then you can
Girl,
go ahead and go on and do other things too.
girl, you are reading
But
my mind. I am like putting an
yeah,
ad out today.
yeah, there you go. And because our body is connected, and like the old song, the shin bone's connected to the ankle bone, we have to look at other muscles, like you said, that can be affected, like the occipitals and the traps in the spine. So Priya, we massage and does a lot of massage, but the TMD sometimes it just doesn't go away, but it's more tolerable with
Mhm.
massage. A lot of people
Mhm.
say it doesn't do it all. Well, we know that, but if it can just help relax you a little bit, then that's okay.
Yeah, that's it. It's more tolerable because really the muscles have memory, right? So even if you massage those trigger points out, if you leave the office and just go right back to your clenching all day, or
Yeah.
even if you don't, again, the muscles have memory. So they'll pull back or kind of like coil and tighten back up into that
Hmm.
original tight position. So it's helpful temporarily, but it's not going to like solve the problem because many times the issue that's really at the crux of everything is the way the teeth come together is putting the
Hmm.
muscles in an angry position, right?
Right.
And so that's where our neuromuscular orthotics come in. That's what I excel at. That's what I do is I'm able to find that optimal jaw position for the muscles, for the joints. And once we find that happy place, then the muscles are put in that happy place for a significant amount of time when the orthotics are worn. And that's when they can come out of that dysfunctional state, like long term.
Yeah. So how about acupuncture?
Yeah. So, I mean, I have had some acupuncture myself, not for
Hmm.
pain, but my baby was turned the wrong way.
Oh,
And
wow.
yeah, yeah, yeah. So she was breech. And so my doctor recommended, try acupuncture to see if it works. And it was interesting because and they don't actually put like needles into your belly or anything. Like the needles, the pressure points they use are at the feet for that actually. And they do something
Hmm.
called moxibustion and uh but it was interesting because I went a little bit late in the game. So my acupuncturist told me if you had come at 32 or 33 weeks, we would have had a 90% success rate. But you're here at like 38.
Oh,
I know. She's like, you're
yeah.
just here a little too late and the baby's just too big. So I'm not sure if she's going to turn or not. But it was interesting.
Yeah.
She did it a few times. And I think the first time she did it, that night, the baby moved so much. Like I thought she turned. I think she was trying to turn but,
Hmm.
it didn't end up working for me, but I think I just got there too late. But what about you? Have you ever had acupuncture?
Yeah, actually, I've had it for my knee. My niece is an acupuncture in
Hmm.
Columbus, Ohio. So I so truly believe in it, not just because she's an acupuncture, but I had it for my knee, and it really didn't help me because I'm bone on bone. I'm a little bit old, so I'm bone on bone. But acupuncture involves needles and the balancing of the body's chi, and for short-term relief I think it's good. A lot of my patients have done acupuncture and they've found that it's also just short-term, and it does involve needles placing in the skin, and some people don't like the needles, but
Sure.
when stimulated, the point sends a message along the nerve to the brain and the spinal cord, and that causes the brain to release endorphins. And these chemicals in our body produce that alters or eliminate the message of pain. So it'll like kind of get right into that and then say, okay, don't send that message of pain. So then with the endorphins released, that's the feel good or the mood regulating chemicals that helps patients feel better physically and emotionally.
Yeah.
Similarly to the effects like of exercising, people get that runner's high. And, I think acupuncture is great, but again, it's a little bit of a band-aid.
Yeah. Yeah, exactly. Like I've seen it help a lot of people, but I don't think it can help like long term
Right.
with this
Right.
when it's
Maybe
too
with
many.
some things, but I'm not real sure about that. But I do believe in acupuncture for
Yeah.
sure.
Yeah, for sure. Well, let's continue down the list. So let's talk a little bit about Botox. That's a question that I receive all the time, and even like local dentists when they hear if I just meet them like out in the wild,
Yeah, yeah, yeah.
um, they'll say, "Oh, you have a TMJ only practice, so you're doing a lot of Botox," and I'm like, "No." So
Right.
it's so common that Botox is linked with treatment for TMJ. Do you have patients that have received Botox? What are your thoughts on it? Let's hear from you.
Yeah. Yeah, so I've had patients that receive it, and I think it helps maybe the first time, but it seems like people will say like it helped and then it didn't help. It stopped helping. And I don't know if the effectiveness decreases or what it is, but I have an only pain office and I see patients that continue with pain. So it might help a little bit. Like, so what are your thoughts? I know you just had Botox and something happened around your eyes
Did you
too.
like that? Yeah.
Oh my gosh, that was a little scary.
Was totally scary. So I've had Botox a few times for cosmetic reasons. It's not for
Mhm,
TMJ, it's not for pain. And there's so much controversy on that, right? Because really, Botox is it's a neurotoxin. It's botulinum toxin. And
mhm,
people will call it a neuromodulator to make it sound prettier, but it's a neurotoxin. So it's like, I
mhm.
know that. And
Right.
I'm a little vain. And so I
That's
decided,
okay.
yeah, it's okay. So I got some at my crow's feet, my 11s, and then my forehead, the wrinkles there. And when the injector was injecting, it puffed out on my eye, and so they got it into a vein. And what
Yeah.
happened after that is it totally bruised. So I had this crazy looking bruise for like 2 weeks. I mean, it took a full 2 weeks for that thing to go away. And it was intense. So I'm never gonna have Botox there again, and maybe not even here. I'm, like, looking into different options because that was awful. But
Well,
but
let me tell you, it's like you had like raccoon eyes. I mean, not to be, but that's what I mean, that was how it affected
oh,
you.
it was crazy. I mean, I put it on my social media because turn it into content. Fall else
Right.
fails. I look crazy as it is, might as well just turn it into some content. So I put it out there, and it was, yeah, it can definitely do that. And but yeah, I'm I'm laughing because I know you saw that and you were probably like, what on earth happened to her face? Um, oh, so Botox. Let's talk a little bit more about Botox. It's
Yeah,
supposed
yeah,
to
yeah.
help for about 3 months. That's it, and then it wears off, and then you have to come back for more injections. So it's not really getting to the root of the problem. It paralyzes the muscle, yeah. So if you get it frequently, it can help with the pain, right? But it's not helping with the alignment issue that's causing the pain in the first place. So if
Mhm,
the muscle is paralyzed by Botox, right, it doesn't move. Every muscle has an origin and an insertion into bone.
mhm, mhm,
And when the
mhm.
muscle moves, it stimulates the bone. So if the bone isn't stimulated, it can become necrotic. And I have to emphasize this is very rare. That's not something
Right.
that happens commonly. But and with TMD, there are a handful of muscles that Botox can be injected into for some relief. So it can't be injected into every single little muscle that plays a role in your TMJ pain. It can be injected into the masseter, into the temporalis. And so I do this for like a handful of patients a year that are really kind of twisting my arm to do it. I'll inject it into there, but I always make sure that they have been had a sleep study. They're not diagnosed with sleep apnea because injecting into the masseter can cause issues, etc. But there's a main player, two main players, really, the lateral pterygoid muscle and the medial pterygoid muscle. As weird as those names sound, they are really key players in TMJ dysfunction, and they cannot be injected with Botox anyways. So it's kind of tricky. Like if you inject the masseter and the temporalis, but the pain is coming from the lateral and medial pterygoid, the pain is just going to stay the same. So it's kind of I'm willing to try it, but there's very few people that I do it every 3 months because I usually am like, "We need to move on and try to find something else." So
Right.
I'm not anti-Botox. Like I said, I've done it myself for cosmetic reasons. I just think it's a very expensive Band-Aid that wears off in 3 months or less, and
Right. 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 And then we have PT or physical therapy. And I love PT in conjunction with my neuromuscular treatment. And what I love about my PT is he looks you over from head to toe, literally. I mean, he'll look at your gait, he'll look at how you walk, he'll look at your posture when you're sitting at your computer, and he'll look at the ergonomics and check your hips out. And I mean, there's just so much that he checks out. And but again, it's short lived unless you get in there and you get the body or the jaw back into alignment. And that's my opinion. And so I have to compare to a porch swing. I always do this with patients. So if you're misaligned and your jaw is out of alignment and you have, 5 rings of chain on the one side and 3 on the other, that porch swing is going to be different, so and swing differently and not as comfortably. And that's the same with your jaw. So you've got to balance that out, so then the muscles on each side can balance out and get to a good length that's not causing you pain. So it's all about looking for strengthening the muscles to hold the bones in proper alignment. And that's where the PT can help do that. If you've got a head tilt, now we put an orthotic in there and we get you back up straight. Well, now we got to get the muscles on the one side to be able to hold the body into that position.
Yes. Yes.
Mm-hmm.
Totally. And yeah, we have some physical therapists I work with here as well. And I also work with a few local chiropractors as well. With the chiropractors that I work with, they are a very specific type of chiropractor, upper cervical chiropractors. So they do not do any pop, twist, or cracking of your neck. So a lot of people hear chiropractor and they like run for the hills.
Yeah.
So I just want to say, come back for a sec. It's not the, and not that the pop, twist, crack is bad, but many people are afraid of that. They don't want that in their neck. And I actually think the gentler stuff that the upper cervical chiropractors do, the gentler adjustments, work better for TMD. That's just what I've seen. So the ones that I work with are NUCA, National Upper Cervical Chiropractic Association, and AO, Atlas Orthogonal. Both of them adjust the upper cervical vertebrae in a very gentle way. So they take a series of x-rays that show C1, C2, C3, the upper cervical spine. And they show you if those vertebrae are, if they're rotated, if they're tilted, laterally shifted, if they're misaligned in any way, that'll put pressure on blood vessels, on nerves that run up to the head. Right. And that can create pain. It can create dizziness. It can create a lot of discomfort. And so gently tapping those vertebrae back into alignment and adjusting my neuromuscular orthotic as we go along has helped a tremendous number of patients. And so I've had a lot of success with that. There's some testimonials on my YouTube, Instagram for patients that have gone through that. And so I work with the upper cervical chiropractors in my area a lot.
Well, and the other thing too about the upper cervical chiropractor, what they do too is they help the spinal fluid flow better. So that is huge. And I've found with my patients that whenever they're working with a chiropractor and I'm working in conjunction, what I'll do is I'll have my patients go to the chiropractor, then come immediately to my office so I can make my adjustment on my orthotic when they're in alignment. And then what we tend to see is they need to see the chiropractor less frequently. They may have been a couple times a week, 1 time a week, and then all of a sudden they're like, my chiropractor's like, I'm holding my adjustments better. Yeah. I'm like, duh, give this woman a little credit.
Yeah.
That's what's going on.
Yeah.
So the last thing we have is medications. So some people go on meds because of the pain. I would say in my office, when people are in for consults, probably 80% of my patients are on some kind of pain med, antidepressant med, anxiety med, because this just totally rocks their world
Yeah.
when they have some kind of pain that you go everywhere and nobody can identify it, or people say, well, that you're going to have to learn to live with it. So once the pain diminishes through our treatment, you see them then going back to their physician. I never take them off the meds, but I have the physician slowly wean them off the meds. And some people need those meds. You know, they might have had some trauma or something in the past that they just need those meds. And I'm okay with that. But a lot of times when you see people start coming off of it, they're just amazed, because we know a lot of times one med can lead to another med, because you get symptoms from the first med, and then it's kind of like a vicious circle.
Sure.
But
Sure.
you know, I think it's great when physicians are able to work with you and help you wean patients off of these meds. It's
It is.
amazing.
It is amazing. Yeah, we weaned a patient off of gabapentin. I mean, it took a long time. It was like over
Sure.
the course of like almost a year, but we
Yeah.
weaned her off of gabapentin and she was thrilled because some of these medications have really strong side effects and it affects your life, your quality of life. And so that was pretty neat to see. And so I hope that for anyone that's watching, that this answered some of your questions on Botox too. And I kind of want to take it back, Alex, for just a second
Sure. Go
to
ahead.
Botox in the masseter muscle specifically, because that's where most people
Okay.
get it for TMD. So with that, if so oftentimes sleep apnea and TMJ kind of come hand in hand, right? And so
Right.
sleep issues and TMJ issues are so closely linked. And
Right.
so if you're struggling for oxygen at night, what happens is your body goes into fight or flight mode. And then it's believed that we clench and grind our teeth, and grinding the jaw forward will actually open the airway. So for some, it might be a mechanism of, hey, this is how my body gets more oxygen saturation, right? So you're really utilizing those muscles to grind the jaw forward to get better oxygen saturation. Now, if we start injecting Botox into those masseter muscles, we're atrophying them, we're weakening them. So over time, they're not going to be able to clench and grind. You're not going to be able to open your airway by grinding. So
Good point.
yes, so by diminishing the pain in the masseters, what are you doing to your sleep apnea if you have it, right? Nothing.
Right.
So that's why for the few people that I do Botox for, I have them do a sleep study, or I make sure that they've had one and that they don't have sleep apnea. And even then, I don't love doing it. And so it atrophies the masseter over time, which can make sleep apnea worse if you have it, if it's undiagnosed, or if you have it and you are diagnosed. Additionally, Botox in the masseters over time will slim the face. It'll change the appearance of your face. And there's a person I follow on social media, and she noticed it on herself and she didn't like it. She had a very almost like a square defined jawline, but not like manly. It was like she was
Right.
beautiful. And with the Botox, it totally took that away. And now her face is more like, well, she's still beautiful. She's just a beautiful
Right.
person, but she liked her face better before the Botox. So it can
Wow.
I know. And well, now what do you do? Right.
Yeah.
So it's so I did want to touch on that too, because I feel like we didn't.
No, I think that's very important. And if I have a patient that is like, you know, I was going to get Botox, and if they're in extreme pain, I'm going to say do what you can to bring it down a little bit, but
Yeah.
I can't take records with my
Yes.
EMGs or measuring my muscles until that wears off a bit,
Exactly.
or we take it before, because
Right.
I want to see what the true muscle reading
Yeah.
is.
Yeah.
So it can just compromise the start of treatment,
It
and
can.
that's
Yeah.
okay. But if you're in that much pain, like, you got to find something, and I
Yeah.
get that. I
Totally.
don't oppose that.
Right. Right. I mean, I don't want people just walking around in 9 out of 10 pain all day,
Yeah,
every day. If we can do something to bring it down, great. But I don't love when it becomes like a recurrent thing, because
sure.
what are we masking? We're changing your face shape. Like it's just, there's a whole other realm of that. But yeah. Well, yeah. So I think, why don't we take some time to answer a few questions from
Sure.
our wonderful viewers? So let's see.
Yeah.
Question 1. If it's your bite causing TMJ, will you need braces after phase 1? So I'll let you answer, Alex, and then I'll answer too, because I think we
Okay.
might have different answers to this. So,
Yeah, we might have different
yeah.
answers. No, not always. You don't always need braces. You can have options the way that I treat, and it depends on alignment. And sometimes it'll be something like adjusting your natural teeth with microocclusion adjustments called DTR. And sometimes too, you can continue to wear an orthotic. That's perfectly fine. But braces may be an option too, as long as everything's okay with your bone, with your root structure. So you don't always need braces after phase one. I don't think so. Can you have it done? Yeah. But you've got to look and check a lot of boxes to make sure you're even a candidate for braces after TMD therapy.
That's a good point.
Okay, Priya, it's you.
I just agreed with everything you said. So I thought we'd have different answers, but we didn't. So yeah.
Surprise,
My
surprise.
surprise, surprise. My answer is not necessarily. And so many of my
Right.
patients choose to just wear the orthotic at night. So they're not wearing it at all during the day. They don't have any
Yeah.
pain, any symptoms, but they have to wear it at night because that 7 or 8 consecutive hours of sleep sets them up for success the next day. And there are patients who lose it, they break it, and they're like, oh my gosh, my headaches came back. So
Right.
my patients have to continue wearing the orthotic at night. And then there are patients that choose to move into braces to bring their teeth to that happy place found in phase one of treatment.
Yeah.
So, yeah, great question.
Yeah, yeah, yeah. So we got another question here, and this is from at Dan Rhodes, and they ask, what arm and shoulder weightlifting exercises can you do? Toning this hurts my neck and jaw. Well, I don't know what shoulder exercises you're currently doing, but what I find a lot of times when people exercise, they strain other muscles instead of, if you're lifting with your arms, you should be concentrating on the arm muscles. And if you're if you're recruiting the other muscles that aren't in that exercise, then there might be something wrong that you're doing lifting wise. And that's where I use my PT. I've had this happen with patients, and they're like, well, when I do certain lifts, then this hurts, that hurts, or this is when I get dizzy. And so when I send them to my physical therapist also does a lot with sports people, people that play a lot of, say baseball or golf or what have you. So he is looking at your form when you're doing certain exercises. So if you could find a PT that will also look at your form, because there might be something you've got to adjust. And if you talk to someone like my husband, he's like, oh, I've been lifting weights since high school. Like, I know how to lift weights. Well, maybe his form's not so good, you know?
Right.
So you have to open your mind up. If you're having an issue with certain exercises, then you've got to find out why. And you've got
Yes.
to go to someone that will be able to either train you correctly, answer the questions. And usually a PT knows every muscle in the body
Yes.
and how to exercise it. And so that's where I would put you to. What about you, Priya?
Yeah, I tell my patients who are having really acute TMD pain and dysfunction, I just say avoid arm and, well, it's not arm so much, but especially shoulder weightlifting. Like you're trying to really build your shoulders up, just avoid it for a little while till we get you out of this like acute phase, acute pain.
Sure.
Because when we're doing shoulder exercises, we involuntarily recruit neck muscles. I think everyone
Correct.
does this, right? Like whose form is perfect all the time? When you're on your like 10th rep and you're really straining, almost nobody's form is perfect by that point, right?
Right.
So
Right.
I just say avoid them because if we're recruiting the neck muscles, that can really feed up and affect the jaw and it'll make your neck hurt.
Mhm.
Like they're not supposed
Mhm.
to be used that way. And so I just say avoid it, but I love the PT part of this
Mhm.
that you pointed out, Dr. Alex, because with the
Yeah.
PT, they're going to teach you the correct form so that you're
Correct.
not, yeah, constantly doing that. But at the beginning, I always just say avoid shoulder stuff for a while, and then we'll slowly incorporate it back in. And usually they're
Right.
able to, but it's just when it's so acute and so painful, that's when I really say to just stay away from it for now.
Right. Right. And I know with the PT that I use, he will show you how to strengthen your neck.
Nice.
So,
Nice.
you just have to kind of interview your PT when you call
Yeah.
the office. Like, is he good with sports figures, or or find out the sports teams around you, what physical therapists that they use, and then you'll get your answers and you'll get back to working out right. But if your jaw and neck hurt, then you got bigger things going on too.
Yeah.
And
Totally.
that's where you need to see a good neuromuscular dentist.
Yeah. Yeah, definitely. Well, very good. Well, let's wrap up this episode. I hope you guys learned some stuff, and keep the questions coming. We like answering your guys' questions, and we'll see you all next time on Unclenched.
All right. Bye-bye.